We have all been there. You sit down at 9 a.m. and by the time you look up, it's noon and your back feels like it has aged 20 years. We call it the sitting disease. But it is not just about being lazy. It is about what is actually happening to your anatomy. Today, I am going to break down the clinical mechanism of why prolonged sitting causes back pain. It is more than just bad posture. It is a cascade of biological changes. Let's dive in. First, let's talk about our lumbar lordosis. When you stand, your lower back has a natural inward curve. But the moment you sit, especially if you are slouching, your pelvis will tilt backwards. This will flatten that curve, forcing your spine into flexion. Think of your intervertebral discs like jelly donuts. When you flex forward for hours, this essentially is squeezing the front of the donut, which pushes the jelly towards the back where your nerves are. This creates a massive intradiscal pressure. There's a fascinating and scary concept in biomechanics called as creep. No, not that kind of creep. Your ligaments and tendons are viscoelastic. When you hold them under tension for hours, they start to deform and stretch. Think of a rubber band. When you keep pulling it again and again, it will become loose every time you pull and leave it. This is creep. By the time you finally stand up, your ligaments are temporarily too loose to stabilize your spine properly. This is why many people throw their back out just by reaching for a pen right after a long flight or a long meeting. Here is something most people don't realize. Your spinal discs don't have blood supply. They eat through a process called as imbibition. It's a pumping action. When you move, walk and twist, your discs breathe in nutrients and exhale waste. When you sit still and that pump shuts off, your discs become starved of oxygen and nutrients while metabolic waste and lactic acid builds up. This leads to ischemia, which is essentially suffocation of the tissue, triggering those dull aching pain signals. Finally, sitting creates a muscular tug of war. Your hip flexors at the front get tight and short while your glutes, the most powerful stabilizers of your back, go to sleep. We call this gluteal amnesia. When you stand up, those tight hip flexors pull on your spine like a drawstring, creating a painful arch and putting a massive load on your facet joints. So, what's the cure? It's not just a fancy chair, it's movement. Every 45 minutes, you need to break the creep and restart the pump. Stand up, squeeze your glutes, take a 2-minute walk. Your spine was built for motion, not stagnation. Stay active, stay healthy. I'll see you in the next video. Thank you.